And for today's video, I will be showing you how to properly assess the heart and neck vessels. But before I start with that, the equipments that we are going to use in assessing the heart and neck veins are stethoscope, a alcohol, a small pillow, a pen light or movable examination light, and if you don't have any of that, you can use a alternative flashlight, also a watch, and a symmetric ruler. So as you can see, the equipments that we are complete. So let's get started. So good afternoon, ma'am. My name is Emerald Idolo from University of Eastern Philippines, and I'm your nurse student for today. So for verification, ma'am, may I know your name?
My name is Molly.
Okay. What about your birth date?
Birthday was October 24, 2000.
Okay. So ma'am, how are you today? Okay, good to hear po. So ma'am, which language do you prefer to use? Okay. So ma'am, the purpose of this examination is to identify any sign of heart disease and initiate the early referral and treatment. So there are questions that I want you to ask first, ma'am. So is it okay with you?
Yes.
Okay, ma'am. In past history, ma'am, do you experience a chest pain? Okay, wala naman. Does your heart ever beat faster?
Minsan kapag may mga ginagawang
Okay. What about does your heart ever skip beats or have an extra beats? Okay. Do you tire easily?
minsan kapag
Okay. Do you experience fatigue? What about in difficulty of breathing or shortness of breath? Do you have a difficulty breathing while you're lying down? So ma'am, how many pillows do you use to sleep?
minsan lang mga 1 or 2 pero
Okay. Do you have any frequent heartburn? Okay, what about? Okay. So ma'am, dito naman tayo sa personal health history. So have you been diagnosed with a heart defect or murmur?
bawal.
Okay. Have you ever had a rheumatic fever?
Wala.
Have you ever had a heart surgery or cardiac balloon interventions?
So far naman wala.
Okay. Have you ever had an electrocardiogram or ECG? What about have you ever had a blood test? Do you take medication or use other treatments for your heart disease? Okay. What about in family history, ma'am? Is there a history of hypertension, coronary disease, elevated cholesterol levels, or diabetes in your family?
Wala.
Okay. What about in lifestyle and health practices? Do you smoke, ma'am? Okay. Okay, ma'am. So what type of stress do you have in your life? Okay, so first. Okay, so ma'am, can you please describe what food do you usually eat?
Vegetables.
Okay, vegetables. Okay. So ma'am, nag-exercise ka po ba? Can you please describe your daily activities? Okay. So ma'am, does your fatigue or chest pain or shortness of breath limit your ability to perform daily activities? Please describe. Wala. Okay. Okay, ma'am, that's all lang po. So next, ma'am, I am going to assess your neck vessels. So I do need your full cooperation. So is it okay with you, ma'am?
Yes.
Okay, that's good to hear. So now I'm going to sanitize my hand. And I am going to provide you a privacy key. Okay, so now ma'am, I am going to inspect you. So first I am going to inspect for the jugular venous pulse. So ma'am, can you do a superimposition with me? So ma'am, can you turn your head on their right? Okay, so now ma'am, I am going to look at the your right vein. Okay, so ma'am, your jugular venous pulse is not normally visible. So ma'am, while you're in this position, you have a fully distended condylar vein and may or may not be this current pulse. So next, I am going to inspect for the suprasternal notch or the area around the clavicles for pulsation of the internal jugular vein. So using my tangential lighting, I am going to observe for the distension, protrusion, or any bulging. So I am going to use a pen light. I didn't see any distinction or protrusion or bulging while I'm inspecting for your jugular vein. So next, ma'am, I am going to auscultate for your carotid artery. So is it okay to do a sitting position? So I am going to remove your shade. So is it okay to do this? Okay, so now, ma'am, I am going to auscultate for the carotid artery. So is it okay? So now, ma'am, I am going to use a stethoscope over your carotid artery, and I am going to ask you later to hold your breath for a moment so that your breath sounds do not conceal for any vascular sounds. So is it okay? So now I'm using the stethoscope. Okay, so using the bell, I'm going to. Can you please hold your breath now? So, ma'am, I observed that I didn't hear any blowing, swishing, or other sounds while I auscultated. So next, ma'am, I am going to palpate for the carotid arteries, and I am going to palpate each carotid artery by placing my pads of the index and the middle fingers medial to the sternocleidomastoid muscle on your neck. I palpated, your pulse or equal is strong, A2+ or a normal with no variation in strength from the beat to beat, and the contour is normally smooth and rapid on the upstroke and slower and less abrupt on the downstroke. So next, I'm going to inspect for any pulsation on the anterior chest over your heart. So can you just stand right here? So I'm going to look for the apical impulse or any abnormal pulsation. Just stand right here. Okay, so I'm going to look for the apical impulse or any abnormal pulsation. Okay, so ma'am, palpate for the apical wall. So okay, while I'm on the right side, now I am going to use my 2 finger pads to palpate for the apical impulse in the mitral area. Okay, so I'm going to lower your cheek. I'm going to palpate for your Ma'am, I observe that your apical impulse is palpable. So next, I am going to palpate for the abnormal pulsation. is no pulsation or vibration that are palpated in the areas of the apex, left sternal border, or the base. So, base and pulsation. Okay, so now ma'am, I am going to auscultate your heart rate and breathing. So using my second hand watch, I am going to auscultate and identify your systolic and systolic. So I am going to auscultate for the extra heart sounds and auscultate for the murmurs. So using my stethoscope, I am going to while I'm getting your heart rate, I'm also listening to your rhythm and heart murmurs, and that is normal. And you have a regular rhythm. Also, while I'm listening to the systolic one, there is a distinct sound is heard in each area, but at the loudest at the apex, it may become softer and with the inspiration. And while I'm listening with your systolic 2, I heard a distinct sound in each area, but is the loudest at the base. And it is split. Systolic 2 is normal and termed by the physiologic splitting. It is usually heard late in the inspiration, and the second or third left interspaces. Also, ma'am, normally there is no sounds. Are heard, and normally there is no murmurs are heard. And next, ma'am, I am going to auscultate for your apex. So can you do a lateral position? So now I'm using my stethoscope. I'm going to use the bell, and I'm going to listen for the apex of her heart. So ma'am, both your systolic 1 and systolic 2 heart sounds are normally present. So next, can you do this position? Thank you for your cooperation, ma'am. And lastly, I am going to formulate a diagnosis. So a nursing diagnosis analyzes the patient's needs. So first and foremost, we have to collect and analyze the data. So here the patient's referral form. Okay, since today's date. Okay. So my referring patient's information. So my patient's name is Pauline Acanto. Date of birth is on July 25, 2001. Age, address, and contact number, which is confidential. Also, in preferred contact name. So the patient's mother is Mrs. Fatima F. Acanto. Also here, contact number. So here the reason for referral. So Ms. Acanto was referred to the heart and neck vein assessment performed by me, Nurse Ambrose Lolo, to evaluate evaluate and observe if there is any problem, abnormalities, or condition that Miss Akanto is experiencing. So asking some relevant questions to elucidate confirmation and timely insight to the health record of Miss Paulina Canto, and can point out some early symptoms or identify the certain condition that may require an early attention. So hence, I assigned nurse would better understand about Miss Akanto overall evaluation. So here, the health summary of my patient. So the actual diagnosis or the subjective. So my client said that she didn't experience a chest pain. Also my client said that her heart rate is normal. Also my client said that she doesn't feel any tired easily. Also my client said that she didn't experience any fatigue. Also she did not find herself having difficulty breathing. Also she did not see any symptoms of having a trouble at breathing. Also my client said that she didn't experiencing a frequent heartburn. Also the inverse diagnosis. Also my client said that she wasn't diagnosed with heart or any murmur. Also my client said that she didn't get a rheumatic fever. Also she didn't get a heart surgery or cardiopulmonary intervention. Also she said that she didn't get a electrocardiogram. Also my client said that she had a blood test called a lipid profile. Also my client said that she didn't take any medication or use any other heart treatment for any disease. Also my client said they did have a family history of hypertension, any coronary heart disease, or elevated of a cholesterol level or diabetes in her family. Also in wellness diagnosis, also my client said that she never used a tobacco products or any cigarettes. Also my client said that she do sometimes stress herself at school. Also my client has a readiness to stay and fit and healthy. Also my client stated that she didn't find any difficulty in performing usual daily activities. Also my client said that she can take care of herself also. So the second part is identifying the related factors. So here's the patient's mother, Mrs. Fatima Acato. So good afternoon, ma'am.
Good afternoon.
So ma'am, I am going to ask you a question that related on your daughter's assessment. So ma'am, is it true that she did you have a history of hypertension in your family?
Yes.
Okay. So thank you, ma'am. That's all. In third part is to make a clinical judgment. So here is my overall diagnosis of my patient. So I observed that her jugular venous pulse is not normally visible with my client sitting upright. Also, I didn't see any distension, protrusion, or bulging while I'm inspecting her in the jugular vein. Also, I didn't hear any blowing, swishing, or any other sounds while I was palpating her. Also, I didn't. Also, her pulse are equally strong to plus a normal with no variation with strength from the beat to beat. And the contour is normally smooth and rapid on the upstroke and slower and less upstroke on her downstroke. Also, I observed that the apical impulse is palpable. Also, there is no pulsation or variation are palpated in that areas of the apex, left, external border, or the base. Also, I observed that the rate is normal and has a regular rhythm. Also, I heard a distinct sound on each other area, but loudest at the apex and maybe become softer with inspiration. Also, I heard a distinct sound in each area, but it is the loudest at the base. A speed of S2 is normal and turned by the physiologic splitting. Also, I heard a normal sound of my patient. Also, I didn't hear any murmurs. Also, both the systolic 1 and 2 heart sounds are normally present. Also, I heard it well the systolic 1 and 2 heart sounds. So lastly, they're referred by the healthcare provider's name, which is me, also the signature, which is important, the address and the contact number, which is confidential. So that's all for the assessment of the heart and neck veins of my patients. Thank you.